Welcome back to Spotlight. I'm Ed Juenka, and I'm here with my good friend, Ms. Ivy George, the coordinator of Health Promotion Services in the Ministry of Health and Social Development. It's good to see you, as usual.
Thank you. It's good to be here.
Good, good. You're busy, busy, busy. You have a lot of work, and you got a new initiative. You're trying to get the people healthy. You got, you have your hands full. You're trying to get us into a mode of activity. You just launched your STEPS program. You're getting out to launch your Healthy School program. You're really working hard.
Well, this was all part of the plan that we would put the infrastructure in place for us. We had some time to review some very good programs, and now that the infrastructure is in place, we have consensus on some of the programs and have funding. We are rolling them out.
Well, you say you got money too? So the Healthy School Initiative, what is that?
Okay. The idea about the chronic disease program, the strategies for 10 years, and it is called Towards a Healthy Virgin Islands. And one of the things that CARICOM have pointed out in developing programs for the prevention of chronic non-communicable disease, that we are using a life course approach, meaning that we are starting from infant all the way to adulthood. And so for the last 4 years, each year at Caribbean Wellness Day, we introduce another life course. So in the year when we did, last year we introduced Walker's Health. But before Walker's Health, we started to work on activities to improve the school-age child. So the Healthy School Initiative is towards that population. And this is a venture between the Ministry of Health and the Ministry of Education, with education taking the lead, since education is responsible for the school-age child.
And that all it's part of the memorandum of understanding that was signed between the Ministry of Health and the Ministry of Education a few months back?
Yes.
Okay. So when is this going to be started now? Has it started already? When is it launch? How is that going to work? How is it going to be rolled out?
Okay, what we have done, we wanted to launch the overall project. We want people to be aware that this project is coming on stream. So we are starting from now to do sort of like the education campaign, as well as we just completed the first phase where the teachers were preparing materials that will be taught in the school year starting in September. We are using 2 grades, grade 2 and 3. And the program is really around physical activity and nutrition. We are using, because it's chronic disease, the 2 things that we know that will help children are good nutrition and physical activity. These are protective factors that will help to improve health, delay the onset or the prevention of chronic non-communicable diseases. And I must tell you that it is very important because, as I said, let's say when I started out first in health many years ago, we saw people coming down with diabetes, high blood pressure, and heart disease in their 40s, 50s. But now what the research is showing, and data even here, is that you have children as young as 10 years who are now coming down with type 2 diabetes, which is sort of what we call long ago adult onset diabetes, which is not good. Because to me, if you start having a condition like this so young, you're going to be maybe placed on medication, you're going to be on diet, etc. And if you are not careful, it means that that child could have a shorter lifespan, a poor quality of life, or end up with a complication, blindness, amputation, or on the dialysis machine.
And you're also talking about young people who are young now, but in the next 15, 20 years would be a burden on the state in terms of health care.
Yes, because one of the things that happen with chronic non-communicable disease is that it's a lot of the unhealthy habits that we have when you're in childhood or even in your youth, then you see the manifestation in adult.
So I'm hearing you correctly that this is a primary school intervention and not a secondary school.
No, we are starting because actually the program, we are working with CARPHO, which is the Caribbean Public Health Agency. And originally when they developed that program, it was in secondary school. So in our discussion with them, we said we want to start in the primary school because it will be more successful, we think, because the primary school has a different sort of focus. The children will be younger, and therefore if we start, we could then follow them. So you're starting at 2 and 3. Next year we'll add 4 and 5, 6, all the way.
And this is 2, 3, and 4, and 5, and 6, and 7 grades.
Yes, we will add them each year. We'll add another 2.
And what kind of information the program is going to be bringing to the schools?
Well, like as I said, there are 2 of the concept deals with physical activity. One introducing a variety of physical activity, and the other one is trying to make sure that their physical activity that the student will eventually be doing 60 minutes of physical activity 5 days a week. Now,
so this is going to be mandatory in the school?
We are working towards that. So, but what we are saying is not meaning that we are going to be adding anything, because physical activity don't necessarily mean PE. It could be it's movement and different things that you could do during recess, before school, after school, all accumulated for your 60 minutes.
Now, when I used to go to, when I was when I used to go to school, and my brother was in school, in primary school in New York, and I finished secondary school in New York, that was a part of the curriculum. The primary school curriculum was that you had health education and physical education, and you had to pass, you had to get a grade for that and pass that in order for you to graduate to the higher grades. Is that a system that we're planning to put in place?
Well,
this is just a volunteer thing. How is it going
no,
to how is it going to be enforced?
One of the things we are, and not so much for a grade, because one of the things that we really are trying to do is to bring about behavior change. We are trying to build skills. You have knowledge and you have skills that children will be able to use throughout their lifetime that will help them to be more healthy. Meaning, for example, we want to teach them about food, what to eat, how to prepare it, how to grow it. So you'll have the classroom activities, but we are encouraging schools. Some already have school gardens. The children will have a chance to learn about growing things and what that means, and also during the breaks and so in the after school activity, learning how to prepare age appropriate things in a healthy way.
So the teachers are going to be engaged in this activity with the students. I'm trying to get at the method by which you're trying to include this in the school setting, in the school activity, in a way where it's going to be successful, because I'm sensing, and correct me, and I want to be corrected, that you're looking for people to just buy in to this new behavior because it's good for them.
Yes, it's good for them. And
Instead of saying, this is what you have to do in this setting, and every day you come to school at this certain period of time you are going to have gym, and at this certain period of time you're going to sit in the classroom and you're going to hear about nutrition and foods to eat and how to prepare the food and so on. Or you're going to just say, well, there are healthy foods, and you should tell your mother when you go home to give you a healthy snack, and and hoping to get buy-in. And to me, those are two different methodologies, and I think one has worked and the other is a gamble.
Well, there are 4 components to this program, and the behavioral curriculum, which is what will be taught by the teachers, is just one component. Then you have activities that the whole school will do around certain health days, etc. We will also be working with the teachers and the principals to help them to understand why this is important. We will be working with parents because we want we don't want to have a situation where children are, well, sometimes you have this, children will go home and say, well, the teacher said don't do this, or I shouldn't eat this. So we want to be able to have, for parents to be aware as well as to why we are doing what we are doing and how this will benefit their child, both their health and also their academic performance. The same thing, we also know that there are people around the school who prepare snacks and food for children. We also would be working with them so that we are trying to create an environment that will be supportive to what we are teaching, so that you'll have a situation where it will be easier for children to make healthy choices.
Are you going to say to the vendors around the schools, you have to provide you have to provide some more fruits and more vegetables? You have to perhaps have them already peeled and cut up and put them in bags so they're easily accessible and easy for children to have as snacks, and to perhaps put the potato chips and the other stuff further back in the background and put the fruits further up in the front. Are you going to engage the vendors in that type of discussion?
We will have discussion with the vendors, and we will come to agreement as to how we can both win. This is, if we say, well, you don't sell as much candy as before, then we will also have to suggest what you can sell.
So do you think that legislation is required to say, for example, vendors within a 2-mile radius of a school need to have this type of inventory, food inventory, to sell? You think that will become necessary?
We hope not. We do already have a policy for vending machines, that for sure, as to what should be sold in vending machine around public places, which would be including schools. And we will work with vendors and say, educate the children, educate their parents, and hope that we can have a good, because we are not trying to put anyone out of business, but what we are saying at the same time, we cannot allow we cannot encourage people to make sales or make a living at the expense of selling something that we know that will be harmful to our children.
So I have to go over this again. It's not going to be a situation where the children are going to come, or is it going to be a situation where the children are going to come to school and I don't know, whether they have periods in the school where they have different teachers?
They do have periods, but I'm saying
so
let
me finish the question.
Okay.
So when you go, 4th period is gym, and 5th period is math, and 6th period is health education, and 7th period is English. And what I'm saying is, that by saying it that way, that within the school system and within the school curriculum, those are going to be classes that you're going to attend that is going to have certain information and activity that is going to increase and improve your health.
That is already happening in the school. In the school, children already have physical activity, physical education. It's right now, I think, for most school, only 1 period a week.
1 period a week?
Yes.
Is that going to be increased?
Well,
So every day? Because I had to do it every day.
well, I'm saying that wouldn't be one of the things that will happen in September. That is one of the 7 concept that will be introduced, but that one will be at a later date because it will take some more work to get that done. But they do have some physical activity already, and we know that they do teach health as part of the science curriculum. But this, like I said, the way how this activity is set up, it can be also taught in other classes. You can, for example, if you're doing English, you could talk about the food groups and healthy food and unhealthy food, etc. It will be, but the main difference is that we are trying to build skills in students. It's not so much how to get a grade. What we want is when children go home, they know, okay, why it's important to have fruits and vegetables, what is considered fruits and vegetables. They can learn to read the food labels. And that's the kind of stuff that we are looking for. And as you are talking about snacks, they will have option besides what they probably now think are good snacks.
What plans do you have for the parents?
Well, again, I'm saying we will be working with the parents to have them go through some of the same type of material, and we are hoping that we'll be able to offer some kind of healthy cooking class to parents who we can't say mandatory, but who would like to. We will also make that option. That is one of the options that we will be making available.
Because you realize that there is a challenge. The children are at school. You're hoping that the school children will go home and say to mommy and daddy, I don't want that anymore. I want some fruits. I want an apple, or I want a banana. I want some fruits instead of some chips for a snack. That's the hope?
No. We are, just as we are training the teachers. Before we roll out this program, we will have session with parents, starting with the age groups that we are working with. We will have session with the vendors, so that when everything would sort of be rolling out around the same time. So that's one of the reasons we are starting early. So this will give us time to begin to work with parents as well as the vendors, the principals, and well, we are already working with the teachers who we are hoping will roll this out, and also we will be training them before they go into the classroom to introduce the product.
So let's go over again. The program is going to be starting in September.
Yes, that's what we are hoping.
So that
will
would be
happen.
for the fall term, or
Yes.
what you call that term here? What we call that term? Anyway, I know that's a fall term.
Yes.
Yeah, so it's going to be the fall term, and there's going to be some information coming into the schools. Teachers are being trained right now.
The teachers are right now developing the lesson plans that they will be using in September.
So come September, parents need to know that their children are going to be getting education on nutrition and activity.
Additional information and skills, and how this differ from what they were doing before, and that the fact that we are trying to help children now to gain skills and knowledge to help them to be able to make healthy choices.
And you want the parents to come on board and to reinforce the information that they're going to be, the additional information they're going to be getting in school, reinforce that at home to
Yes.
make sure that that it holds and the children do indeed begin to make healthier choices.
Yes.
There's going to be a challenge, of course, with we're under the tyranny of the clock, so I want to get in as much of the program
Yes,
as,
I
as
understand.
possible. And there's going to be a challenge, of course, with some parents because, as you know, good food is more expensive than bad food. And where
I'm not sure.
where a bag of potato chips costs $1, an apple might cost $2.
I tend to disagree
Okay.
with people say that all the time, that good food or healthy food
Healthy.
costs more. I do agree that there are some items that might cost more, but for example, what we are saying, for let's take myself. I have always been a person who have been interested in eating healthy, but as I mature, I have begun to really, zero in on it in a more stringent way. And so what I have done is I cut out a lot of the other things. So I'm using the same money, but I am not adding the nutritional or the things that I want now to what I was doing before. I have cut them out. So in a way, the bill is more or less, and you look for bargains and so forth, and you find ways to.
So it's just a matter of choice.
Choice,
The price
yes.
is not going to cost more money. You're just making a different choice, a healthier choice, which you're going to pay the same amount of money, but you would have a better source of nutrition.
Yes.
And that information you're trying to bring to the parents as well as the young people.
Yes.
Anything else that we didn't say?
Yeah. Well, I just want to say, I really just want to ask the encouragement of parents, of the school community, the whole community, that this is something that is very important, that we really need to begin to help our young people to change lifestyle. It's important that we do so, because if we continue down this road, it's not going to be in our best interest. And the fact that 80% of chronic non-communicable disease are preventable, and 40% of the cancers, then I think it's in our best interest to prevent instead of continuing to treat, which is much, much more expensive, and we cannot afford it. Okay.
Thank you very much, Sister George. Well said. Going down the road with unhealthy children from now in the next 15 years, that healthcare burden, that healthcare cost is certainly going to be unsustainable. I don't care how much national health insurance we have. So I'm hoping that the parents will pay attention to what you've said and take heed and try to encourage themselves and the young people and the whole community to make healthier choices. Thank you very much for being my guest on
Thank you.
Spotlight.
Thank you for having me.
Yes. We're going to take a break. When we come back, we're going to come back with Sister Sylvia George. She's the Health and Safety Project Coordinator. We're going to talk about health and safety in the workplace. Don't go away. We'll be right back with more Spotlight right after these words from our sponsors.
Spotlight is brought to you by the National Bank of the Virgin Islands and CCT Global Communications.